Lywyd. Now, Welsh Government has so far refused to recommend that people should wear face masks when out in public. The latest advice I could find from Welsh Government is that people could wear them if they want to, which isn't particularly useful because people look to government for leadership at times like this. And I must say the evidence that I'm seeing is getting much, much stronger on this. A major report in The Lancet this week found that the wearing of face masks could be a very useful contribution towards keeping infection rates low. World Health Organization absolutely saying the use of masks isn't enough on its own, but saying wearing a mask can limit the spread of certain respiratory viral diseases, including coronavirus. Center for Disease Control in the United States recommends them. There was an interesting study from California and Taiwan end of May, saying the virus can remain infectious indoors for hours, and that measures designed to reduce aerosol transmission must be implemented, and I'm quoting here, including universal masking. Now, some 50 countries, I think, now insist that people have to wear masks, at least in some situations, just on public transport in some countries, far more widespread in others. Now, they don't have the physical side effects potentially of a new drug, say, or the mental health implications of lockdown. So surely the burden of proof should be lower on this. And if it makes a contribution, then why not, even if only part of a sort of marginal gains approach? So will government listen to that growing evidence and introduce clear guidelines actively encouraging the use of face covering?
Well, the guidance and decision-making from the government you refer to, of course, relies on the advice of the Chief Medical Officer for Wales, Dr. Frank Atherton. He's reviewed the evidence, and the advice that is current in Wales comes from his advice and recommendations to us. And that is that there is limited benefit, and that he's not in a position where the evidence is strong enough to recommend that people do wear masks in particular situations outside, of course, frontline care where it's part of PPE. When it comes to what might happen in the future, as I've said and will say on a number of occasions, where the evidence changes, we'll be happy to shift our position. And indeed, the Chief Medical Officer will, of course, continue to review the evidence. And each of these, as we've seen on testing policy, it's possible that evidence changes fairly rapidly. We made 3 different choices on policy over a 6-week period on care home testing because the evidence base had changed at a really rapid pace. And that's pretty disconcerting for the public, I know, but it's pretty disconcerting for decision makers as well. But if we're not prepared to be agile in decision making, be prepared to reconsider where we are as that evidence base firms up, then we won't be in the right position. So it is possible there'll be a change in the future, but the current advice from our Chief Medical Officer is not to do so. But as I say, I wouldn't want to close off the reality that that advice could change, the Chief Medical Officer's advice could change, at which point in time, of course, you would expect ministers to make a different decision.
Yep, and I'd urge you to ask the Chief Medical Officer to look at this. You say it might be something for the future, but when we're fighting coronavirus, the future is now, in a way. What's going to happen with the pattern of the disease in Wales over the coming months can be affected by decisions that are taken now. I've spent much of the past 3 months pushing for the best possible protection for frontline staff. You mentioned them, of course. I still need to do that. Maybe you could comment on reports of out-of-date PPE still being in use. Masks expired in 2008, being seen by nurses with stickers underneath saying expiry 2016. I'd be grateful for a copy of guidance on the process that's followed to decide when expired PPE is fit for reissue. But on again, to finish, on that issue of the public wearing of masks, a homemade mask is much better than nothing. Of course, it means there's no impact then on PPE stock for key workers, no real cost either, so issues of equality are addressed in that. Worldwide, there are community schemes making masks, including groups in Wales. This is my mask. Actually, this has travelled across the world. It was made by a friend in the United States, part of a community group making masks to give to others. Now, will you support a Mask Cymru initiative, urging more people to get involved in making masks, sharing simple templates and so on? This is something we can all do, bonding as communities. We have even competitions who can make the best looking masks and that kind of thing. It contributes to the normalization of the wearing of face coverings. And just perhaps, if the growing evidence is right, as I believe it is, it could save lives too.
On your point about PPE, all of our PPE that is issued goes through a quality control process. including if initial expiry dates mean that that PPE can still nevertheless be used and used safely, because that is the test that we apply. Have we got adequate PPE, adequate in terms of protection it provides, making sure there's in date and appropriate for staff to use? And as you know, we're in the position where we have not just managed to resolve our own current PPE challenges for our frontline health and social care staff, but we've provided mutual aid in significant numbers to other UK countries, including England, and that's been the right thing to do. So we're in a good position on PPE compared to where we were just a matter of a few weeks ago. There's got to be a warning note on that, because as we move forward with the peak of the disease, entirely possible there'll be more pressure on where we are as we ease and come out of lockdown, or what might happen in the winter. And equally, demand in other parts of the world might mean that there's again greater competition for PPE supplies that we're acquiring. But I want to put on record my thanks to those Welsh companies that have created PPE for our frontline staff. It's been a tremendous response right across the country. On your point about masks and face coverings, I think it's important, because when people talk about masks, I think there's a lot of confusion about those being things that are the sort of grade you expect frontline health and care workers or others to raise. But I recognise you're making a point about face coverings, which are different. If the advice changed, then we'd of course need to think about how that would be, because I don't think the government would be in a position to provide face coverings to every member of the public, but these are things that people can provide themselves. And it's actually important to remember this is about protecting other people in case you have coronavirus. But the starting point is, if you're symptomatic, you shouldn't be out in public anyway. You should be self-isolating, you're getting tested. If the advice changes, we'll of course need to consider what that means in terms of how those face coverings are provided and in what settings. So like I say, going back to my first answer, if the evidence changes, if the advice changes, then the government will be happy to explain that and to change our position, because our aim, as ever, is to keep Wales safe.